I'm sitting with my eye surgeon, Dr. Gulani, and I am about 2 months post-op from Pinguecula surgery. And I am from out of town, and just here asking a few questions. Dr. Gulani, tell me in your own words what you think are the most important considerations for a patient that is considering having this operation.
I think the most important thing I emphasize, Tom, as you know, when you came to see me first, is the seriousness of the surgery. Yes, I'm blessed and very thankful that our results have been so excellent and all our patients are doing well, but I'm constantly collecting data to make sure we have honest science behind this. And as you recollect, I try and even maybe send you back home, like in your case when you came from Cleveland, after an extensive discussions, like, Tom, go home, research, then when you're sure, come on down for surgery. And when you came in, we did the surgery, and I think patients must understand that even though I personally strive to make this look good too, it is finally a human eye. We are not working on just canvas. The healing still depends on each one individually. Yes, we are recording day one outcomes on all our patients in the mirror, like we did with you too, Tom. And then I think the most important thing, wouldn't you agree, which I went through with you in the room like with all patients, is I keep emphasizing this is surgery, plan properly, don't expect a miracle, but I'm going to try my level best for you.
Absolutely. And when I saw you the first time, I can chronicle it was in January. I saw you initially, and you said, Tom, you have a lot of time. You don't have to do this immediately. Go home, do the research, find out if this is something that you want to do. It's definitely an advanced state right now. It's at some point going to get worse. But I took until April to make a decision to have surgery with you. And when I did, we went over all the precautions. You told me definitely that this is major surgery. When we did have the operation, the day one view of the eye was excellent. So I was elated to see how good it looked. And then your parting words for us when we left 4 days later and went back home were, this was serious surgery. It should be treated as such. You need to baby the eye, be on your medications, on a regimen. I came to you initially when I first investigated this because I knew that you had experience with this type of condition. Back home, even with all the great medical centers and all the great training, doctors, they may be very, very talented. They simply didn't see the numbers that you see of treating this condition, Pinguecula or Pterygium. You treat revisions of patients from around the world that other doctors may have had. And I wanted to be in the hands of somebody that knew what they were doing, had been there before, and somebody I could feel very comfortable with, no matter what happened. So, what other things would you consider when you send a patient back home, particularly in my case when I'm coming from out of town? What are the main things to consider? What would you say to a patient going back home?
Like you summed it up, Tom, you know the sentence I love to tell all my patients is, this is still, it looks great, yes, but it's still serious surgery, and baby the eye. That's the sentence I like to use, is be conscious about the fact that you've had surgery. Now in your case, you were going back to one of the best places in the country, Cleveland Clinic, so I had no problems about your follow-ups and post-ops. But it can again show you that no matter where you're headed, you can have situations where some doctors who are not aware of this technique may do things routinely and end up by moving the graft, which was in your case. And that resulted in a situation where, you needed correction. And I appreciate you coming down with your confidence here. And to me, it's like someone bringing back my painting, having spilled, what do you call it?
Dye
on it. So, but again, I enjoy this trust and confidence with all our patients, Tom. And I think the lesson to learn from this is how to still take care of the eye, especially in the healing phase of the first 1 to 3 months. How to remember that this is a genetically driven disease, Pinguecula or Pterygium. The chance of recurrence is always there. It's just that this technique I have found, at least in my experience, to have the lowest recurrence rate. And thereby I propose it when a patient needs it. Now, summarizing this concept, it will basically mean every patient who has their surgery must understand that this is serious surgery, must take care of the eye and report if there are any problems. We are absolutely thankful, indebted to all our patients, because I don't advertise about this surgery. They go all on the internet, spread their experiences and stuff. But by the same token, we encourage them to also report if there's something going wrong, so we can document it, take care of them, and honestly keep adding that to scientific data.
And that's, as a patient, that's what you want to see. You want to see this very truthful, on time, upfront. That's why I'm here, is so that there are no surprises. You were very honest with me from the very beginning. It can grow back. It's very rare that that would be the case. This is serious surgery. I found that out not once but twice. So there is some post-op, pains. Some patients probably don't feel it as much as others. But it's not just something that you should think of cavalierly, like you're going and getting your teeth whitened at the dentist office. That's not what you're doing at all.
Yes.
You are literally having a portion of your eye cut out and dissected down and replaced with an allograft, and then a very fine piece of amniotic placenta membrane covering that up to protect it. And that's just something your body needs time to heal, and you have to be in a total different mindset. Your life has to change for weeks or maybe months so that you have time to heal.
Yes, in the worst case scenario, like I said, most of our patients, we're very confident about them flying out in a week. But absolutely, they need to understand, like in any surgery, Tom, wouldn't you agree? I mean, you have a surgical background.
I do.
You work in such a big university setting in the surgical suites. With every surgery, I like to actually go overboard with how much post-op care patients need in educating them. And then it's great if most of them, which over 90%, heal within a week and they are done and they get back to their life. That way patients also again get another dose from me about how serious this is, and this is
correct.
Surgery. So at least my philosophy is a patient must understand, yes, we have all these great outcomes, yes, our patients are going on their own and documenting it, but that they should understand that every surgery has a risk to it. And like you rightly said, I love the way you put it, this is not some teeth whitening procedure. Many doctors may be touting it as such. Well, if that's the case, please do your research. That's what I encourage patients, and that's why in your case too, I know many patients, I've had them fly back even as far back as Europe or Asia if they didn't understand the concept of surgery. Because I don't want them to look at this, despite our outcomes, Tom, as a miracle. I mean, yes, my guarantee is I'm going to strive to do the best I can, like in all surgeries I do. But I'm human, and so is the patient. Our healing is still dependent on that, and again, I feel, at least in my experience and knowledge of teaching all this all over the world, is I haven't found a better technique yet. So as I keep refining it myself, I'm looking for honest data, looking to report it. Absolutely, someone like you who's so knowledgeable in doing this research, I think this video is a great way of how we impromptu are grilling each other,
right?
So other patients can learn about what we discuss in the rooms.
No question. What I really liked about it was, first of all, I didn't do it as a cosmetic surgery at all. My pterygium actually bothered me. It felt like I had something in my eye at all times. It actually was bubbling up to the iris a little bit, and not only did it look bad, but I mean, it definitely felt bad. And after surgery, it still feels bad because your body, it takes time to heal. You told me all those things. And then we had a second surgery just to correct some of the things that went, the complications that we had. And now 7 or 8 weeks out after the second operation, I can sit here and say, it feels like a normal eye to me right now. My vision is there. Eye looks good. I feel like I'm unrestricted in most things, but I still have to remind myself, take all my drops, rest my eye when I can, stay out of the sunlight whenever I can. I'm only a couple months out, and the body takes a long time to heal, no matter what we do, particularly the eye. So it is serious surgery. And you were the guy, I just knew that if I had complications, be careful what you wish for, because I knew that I'd put it in your hands, somebody that I felt very comfortable with. If there was a complication, you would be the one to do that. And lo and behold, I had a complication. But you were able to deal with that. And when I saw you the first day, when I flew back down with a complication, you were very, very serious. You answered all the phone calls that I had leading up to that personally, which I really respected. But also the instant you saw my eye and took pictures, you said, yes, we need to fix this. We need to fix this tomorrow. We're going to do that. We went into surgery, and you were very, very honest with me, saying this was difficult surgery. The scarring was very deep. We had to do a very large dissection, and that took even longer to heal. And so I was very, very nervous, but you know, knock on wood, I think things are going very, very well. I think you're pleased too.
I'm very pleased, yes, Tom. And again, it's been a pleasure, Tom.
Yeah,
I love it
too.
when patients do their research. To me, I say this all the time, Tom, I'm indebted to all my patients, you included.
Good.
It's truly a pleasure.
My advice is to come see Dr. Gulani or make a phone call, and he will answer your questions very, very honestly. Ask him anything you want. His staff is very knowledgeable, so is he, obviously, and I don't think there's a question that he wouldn't answer honestly for you. I really do. Thank you very much.
Congratulations, Tom.
Thank you.
Pleasure.